The following content is for informational purposes only and should not be considered medical advice.
Welcome to KC Wellness Talks. I'm Dr. Dawn Ipsen, pharmacist and your host. Join us as we delve into the world of healthcare with local providers discussing common health concerns and exploring ways to overcome them. From simple tips to home remedies to the latest in treatment and technologies, we've got you covered. Today, I am so excited to welcome our latest guest. This is Dr. Angila Jaeggli.
Hello, everyone.
Yeah, so good to have you here.
So glad to be here.
A beautiful spring day in the Pacific Northwest. This is the time of year when you want to be from this area.
Oh, this is when people move here and they don't realize what they're getting into.
They're
like, it's gorgeous,
yeah.
like magic.
Then winter hits.
Yeah,
But anyway, but let me introduce Dr. Jaeggli to us today, if I could. Dr. Jaeggli is the owner and medical director of Sage Integrative Medicine here in Edmonds, Washington.
Right.
She has been a practicing naturopathic physician for over 20 years and is a big specialist in not only family practice, but women's health specifically. And that's where our paths have crossed for years.
For many years.
Yes. We won't go into that because
right.
we're still in our
30.
I know, we're 30.
How weird.
I know, it's really awesome, actually. Yeah, and so with that, obviously with naturopathic medicine philosophy, she's excellent in going to that root cause medicine, really working at getting people to their best self in their healthcare journey and meeting patients where they're at too at that same time.
Absolutely.
Yeah.
Yes.
Thank you for being here.
Oh my gosh, I'm so glad. It's been, we've worked together for a long time.
Yes.
And of course, you and your team are always amazing as
Aw,
well. Yeah, we
thank
appreciate
you.
you so much.
Yeah, it's that synergy. It is truly the healthcare team. And as a pharmacist, something that we were taught in pharmacy school, and I actually get to live it and breathe it, where our team is integrated as part of the healthcare team. And we work a lot collaboratively with prescribers on understanding true individual patient needs and how we can come up with very specific therapies for each and every one.
Yeah.
And with that, one of the things we were so excited to talk about today is that hormone optimization piece.
Yes.
And how that plays into the health journey for women.
Oh, so important. And really this is I would say a topic that, can be relevant for women at any stage of their life.
Yeah.
Yeah. That, I think nowadays we probably see more hormone dysfunction. Will be my guess, just because of a lot of the environmental disruptors that we have going on, like plastic exposure.
Oh, yeah.
And hormones in our food. It's,
Right.
I think there's a lot more awareness around that, but I mean, definitely, so many people actually don't know. It's really interesting to me that I still get people that have never seen a naturopathic doctor before.
Yeah, amazing.
I know. It's that,
Right.
and I'm like, really? And then I'm like, I'm so happy to be your first. This is great.
Right.
And then aren't actually aware of, the hormones in our foods that could be disrupting levels for younger women. And of course, going through perimenopause and menopause. So, really, it's a relevant topic of adjusting and helping people optimize, helping women optimize, men too. But
Sure.
But at any stage, at any age, really.
And it's so interesting. You talk about food, and that's so true. And from a pharmacist perspective, some of the conversation I have are actually about the nutrient depletion that's in our food. But it becomes sometimes complicated and overwhelming. Like, oh my gosh, my food is bad now. I'm not getting the nutrients, and maybe it's got toxins or things bad. And do you have any quick tips or tricks of what you might share with a patient generally on how do you navigate that, or what's an easy thought or two on when you're at the grocery store? What do you do?
Oh, yeah. Well, firstly, this is so interesting about grocery stores. If you just avoid the middle.
Oh, I've heard that before. No ice cream aisle.
You eat from the outside, which is usually where they place all of the fresh fruits, veggies, and deli, right? Fresh meat, things like that. So that could be a good tip, number one. And Number two, accessing resources like Whole30.com.
Oh,
And I am so impressed with these people.
Really?
They have, so they're all about, it's gluten-free, dairy-free, very focused on whole food. They have a million recipes. They give you shopping lists.
what?
They do have coaching around food
Okay.
too, which is
Okay,
great. But
sure.
so many free resources that
Wow.
if somebody has never really started to play with moving into a whole foods diet, it's a
Okay.
great
Oh,
free place to start. Yeah.
Wow.
And their books are amazing too. And like $15 for these beautiful recipe books on
Oh
Amazon.
my gosh.
Yeah. A great resource for
Okay.
food.
So
Yeah.
shop the edge.
Yes.
And
Shop
then
the edge.
check out this Whole30.com to
Whole30,
kind of
yeah.
get your brain started on
Yeah.
eating a little cleaner and healthier.
That's right.
whole
yeah.
food
Yeah.
system.
Great place. Yes.
That is wonderful.
Yeah.
And so that was one of the things that plays into that hormone optimization. I mean, what else are some of the big players that you think about when you're meeting with a woman? Let's say maybe they're past their 20s, maybe they're past having their kiddos, and
Sure.
they're tipping into that like into their 30s and beginning 40s, and
Yeah.
they're starting to have some things going on that maybe they're not even relating to that hormone imbalance or a lack of
Yeah.
optimization.
Yeah, so that's where we're starting. Many times women beginning in their even late 30s, early 40s
okay.
are starting in that perimenopausal journey.
Okay.
And, a lot of women don't realize that you can be perimenopausal for 10 years.
Oh, gosh.
You can be in that in-between state.
Yeah.
And what you get is a
Mhm.
lot of hormone fluctuation. And so
okay.
you'll get surges in
Uh-huh.
perimenopause of estrogen that then give you crazy heavy periods
Okay.
and, lots of pain, and then maybe a lot of emotional lability where you feel
Okay.
like you're all over the place. Then the hormones crash for a while and it's very small, right?
Oh,
and then you
yes.
have very low level hormones. And that's where perimenopausal women might start feeling like, oh my gosh, like it's so hot in here.
Oh,
Like,
okay.
why is it so hot? Flashes,
Right.
night sweats,
Temperature dysregulation.
temperature dysregulation, right?
Yeah.
Ladies, have you maybe experienced a little bit of that?
Yes. Yeah.
And it can be very disruptive,
Yes.
right? You are in your workspace, you're like, what is happening with me right now?
Mm.
Or again, going into mood,
Mhm.
you're feeling irritable and maybe you're snapping at your
Oh,
kids a little bit,
yeah.
or
Yeah.
your husband
Uh-huh.
or, your coworkers.
Right.
And you're like,
No
I'm
patience.
so sorry, no patience. You're like, and
The
you're
string
like,
is short.
yeah, that's right. You're like, this is not me.
Yeah.
Like what's happening to my body,
Yeah.
right? And then when I dive in, so really we want to do testing
Okay.
always,
Okay.
always,
Yeah.
because and we really need to look at ideally, and this is pretty neat about your normal labs like Quest
Oh,
or
yeah.
LabCorp.
Yeah.
You can do total estrogens. That's what
Okay.
I'd recommend, total estrogens.
Okay.
There is an estrogen panel, and so
Okay.
it's estrone.
Mm.
We're looking at estradiol, and we're looking at estriol, right,
Okay.
or weak estrogen, and then progesterone and testosterone levels. So
Okay.
I want to see those in my ladies.
Uh-huh.
Now, there are some deeper diving tests that we can do.
Sure.
Like through Dutch, we can do testing.
To see if the hormones are clearing correctly and leaving the
Exactly.
body as well
Yes.
as coming in or being produced.
Yeah, and those metabolites that sometimes can be a little inflammatory. And
Yeah.
that's where, and we'll
Uh-huh.
get into this in a little bit,
Yeah.
that, we're looking at concerns about like having, maybe estrogens around too long and risk of cancer, right?
Okay.
Like, so that we really want to see those metabolites, right? So we'll get into talking about, who's a good candidate, right, for
Okay.
bioidentical hormone therapy. So coming back, like as a, starting into perimenopause, again, it
Yeah.
can start really early, and that's where we want to get levels
Okay.
and
See where we're starting
see
from.
where we're starting from. We always want a baseline.
Yep. What's on the blackboard at the moment?
Exactly.
Yep.
Right. So let's get those measurements in. Usually like post-mid, like, so after ovulation is a
Yep.
great time, because that way we can see progesterone. Progesterone really doesn't show up,
Yeah.
in the first half of the cycle.
No,
Right. So day 1 through ovulation. For a lot of women, that's day 11 through sometimes 16, but an average is like 12 to 14 is like a good time for ovulation. So after that, your progesterone's going to show.
Right.
So we're going to
about
see.
day 19 is sort of what I've
so when then,
heard.
because then it's surging then,
Yep,
right?
to
So then we
get
get a good,
that-
day.
get that good measurement.
That's right. Yeah. Day 19, 20, 21, 22.
Right.
And that'll also depend on the length of the woman's cycle.
Right.
If they're short or they're really long.
Right.
You know, where it shows up.
And a little bit of a moving target, because I know some of these ladies like, I didn't have a cycle, or I had 2 in a month. Or,
right. Yeah.
so-
And that's definitely, if there's an irregular cycle, definitely hormone dysregulation, right? And then we sometimes also have to, we incorporate the symptoms as well as the testing, because if somebody, their period is all over the place,
right,
your levels, I mean, there are tests through specialty testing like Genova, where you can do every day, you're getting a measurement of hormones.
Oh my gosh.
You know?
Yes.
Right.
Complicated. More expensive?
More expensive.
Yeah, okay.
Yeah. And maybe women want to do that if they're looking at fertility.
Oh,
right?
yes.
And they're thinking, I need to nail down this cycle because
what is going on?
Yeah, and because I kind of actually want to have another baby. So I need to get that everyday measurement. And so those women, you know, they're like, I'm going to spend the money on this testing.
Invested.
Yeah.
Cheaper than alternatives.
Yes,
right.
Yeah.
Sure.
So we maybe are, but a lot of women don't need that level.
Yeah.
And say if, again, we're dealing with like an irregular cycle, we know progesterone is off, for instance, in that scenario.
Right.
And we're going to, because progesterone is what's really going to lock down that bleeding.
Right.
So for a lot of women. So you're managing the estrogen is really driving the progression of that lining, and progesterone is stabilizing it.
Right.
So that's why when we get pregnant, our progesterone also surges to kind of lock in that baby, right?
Stay there.
Yeah, stay there, right?
Yep.
So, so we want to see, okay, what are your symptoms like, right?
Yeah.
What picture? Because we, you know, doctors that specialize in bioidentical hormone therapy and hormone regulation, you know generally what that hormone picture is going to look like, right? In a symptom picture that you're looking at.
Yes.
And it's pretty, you know, you're gonna, what you're seeing in the testing is going to match what you're seeing symptomatically. Yeah. So
what are maybe some of the first initial symptoms that kind of give you that aha? Because what I find is that women in their 30s, like they may come into the pharmacy and start having some conversations with me and not really correlate that what they're experiencing is even hormone related.
Yeah. I think that, you know, sometimes if we're thinking about symptoms that you might not always think about that correlation, mood changes.
Okay.
You know, they're like, something is off and I just feel off and I don't, or I'm more emotional.
Okay.
You know,
laughing one moment,
crying
the next,
and
mad,
then,
happy.
Yeah, exactly.
The bounce.
Yeah, or in their 30s, maybe they're having really heavy periods, right? And again, we're looking at an estrogen progesterone imbalance, or they're not regular, or they are, you know, just something feels like off. Like it's like I was always timely and I felt great and I didn't have PMS, and now starting mid-cycle, that seems to be the time my PMS is kicking in, or 10 days before, and I'm I feel like a lunatic, like I'm going to kill people. And so in those women, you're like, okay, you can support progesterone, which is progesterone, which I love. Progesterone is like the mood equalizer.
Yes.
It is so,
I love it too. Put it in the drinking water.
Oh my gosh, right? Yes. It's calming. I mean, I have some ladies that their husbands are like, did you miss your progesterone today?
Yes.
I just,
Are you
know,
out?
like, yeah, exactly. And they're like, no. And they're like, oh wait, Yeah, I did forget it today.
Yeah,
Oops,
yeah.
right.
It's the one where they come into the pharmacy, the men,
Yeah,
and we're
yeah.
like, oh, don't worry, we got you.
Yeah, we got you.
You're
Yeah,
going
yeah.
home with that today. It'll be fine.
You're like, I'm here. They're like,
Yeah.
I'm here to pick up the
Yeah.
progesterone from my wife.
Right.
Yeah, yeah.
Right. And it's good that we can giggle about it a little
Yes,
because it
yeah.
is normal. And that's the thing is like, we need to
Yeah.
work at normalizing
Absolutely.
this process and these
Yeah.
feelings and these things that just bounce all over and do make us ladies feel like we're losing our mind
Yeah.
and that we're
Yeah.
completely
Yeah.
bat crazy.
Right.
When it's not.
It's
It's
not.
just what the body's set to do.
Yeah, absolutely. It's to change,
Yeah,
right?
right.
And when we think about, I mean, oh my goodness, I feel like women are the carriers of the world,
Yeah, in a lot of ways.
in a lot of ways.
Yeah.
And because, we are like our caregivers at home, right?
Mm-hmm.
Like we're taking care of the family.
Yeah.
And then often a lot of ladies are also working, right? And they're managing the household.
Mhm.
And maybe then trying to also find some small bits of time for
A
themselves.
hobby.
Yeah,
or
like a
involved
tiny
in, yeah.
exercise, maybe, try
Yeah.
to fit that in there.
Yeah.
And so there's a lot of stress.
Yeah. Yeah.
And stress is a hormone disruptor.
Right.
It is.
Oh, right.
100%.
Right. And, I always talk with women about, look, I get it. You can't get rid of your stress.
Right.
I mean, we're still going to be moms
Yeah.
and wives and
Yeah.
business people and
Yeah.
work and have hobbies and maybe
Yeah.
nonprofits or whatever else. But it's how we manage
That's
that
right.
stress.
Yes,
Yeah.
yes. And of course we all have seasons. You
Oh,
have
sure.
times where certain things are more stressful and you have to really support yourself
Right.
more aggressively,
Mhm.
because you're like, man, I have a lot going on right now.
Yeah,
So
sure.
I need a lot of adrenal support.
Yeah.
I really need my doc to be helping me
Right.
optimize my hormones.
Yes.
And I need to be eating really well,
Right.
during this time.
Avoiding sugar, avoiding alcohol,
Yeah,
making
yeah.
sure you're getting
Reducing
to bed.
it, right? I
Yeah.
mean, don't be hard on yourself.
Yeah,
The
for
sugar is
sure.
a go-to because it hits the dopamine
It
receptors, right?
does. It
So
does.
it's very pleasing.
Yeah,
and very
but-
satisfying.
But maybe we
yeah.
do one piece
There
of
you
dark
go.
chocolate
Right.
and a piece of fruit.
There
or
you
something.
go.
Yeah.
Exactly.
But no, I'm with you on
Yeah,
that. Like it's
yeah.
all about moderation.
It is. Yeah,
Yeah.
it is. You have to be kind,
Mhm.
and you have to be gentle with yourself.
Yes.
Because
Mhm.
I mean, when you're stressed, you're more likely to reach for those things, right?
Absolutely.
Your sugars and your carbs. And so
Absolutely.
don't be mean. Just be like, hey, you know what? Today was a day.
Yeah.
And I needed that. I felt like I needed
Yep.
that. Tomorrow will be better.
Right.
It's going to be okay.
Right.
Yeah.
I love that. I love that. Forgiveness.
Yeah, forgiveness. You have to forgive yourself. Yeah,
Yeah,
you do.
absolutely.
So yes, stress, huge. So within this management of your hormones, you really got to bring in the adrenals and that stress
Yeah,
support too.
Right. Lifestyle herbs, is that kind of
Yeah,
what
yeah.
you tend to?
I love lifestyle and herb. Yeah, recommendation. Herbs, I would say, I know Kusler's carries like Thorn and some
Sure.
really amazing brands,
Sure.
right?
Yeah.
That we use quite a bit of. And so
Right.
rhodiola, some adrenal
yes.
herbs that I absolutely
Yes.
love. I don't go without my rhodiola in a
Yeah,
day. It's
yeah.
so good. It's
Yeah.
such an amazing, extends the half-life of your cortisol, which is one of your stress hormones.
Ooh,
And
good
one-
tip.
Yeah,
Yeah.
love it. So, and you can do morning and like afternoon dosing. It
Right.
doesn't tend to keep you awake,
Right.
which is great.
Right. I remember reading a really cool study on rhodiola. And
Oh,
it's
yeah.
what piqued my interest and went, ooh. And it was a study done in Japan, and they actually took college students and they gave half of the class rhodiola, like as they were doing their exams and things, and the
Oh,
other
nice.
half no rhodiola.
Oh.
The group on the rhodiola actually scored higher on their test exams.
Oh, I love
I
that.
know.
I've not read
I
that
know.
study.
Yeah, so I use that with my teenagers of like,
Oh.
maybe this will
You
convince
know,
you for some adaptogens.
Yeah,
So-
totally, right? I know. And sometimes
Yeah,
it is
but-
hard to tell. Like,
Yeah.
we call it like an N of one and
Yes,
a study
yes.
of one person.
Yes, yes.
But I notice a difference.
yeah.
I mean, I'll
Yeah.
take it.
I love
and-
L-theanine
Do
and
you?
ashwagandha.
Oh yeah,
Oh,
those
yeah.
are great. Those are more
Yeah.
gentle, I feel like, than
Yeah.
rhodiola. Actually, a little more L-theanine is very calming for a lot of
Yes.
people, and which is great
Yeah.
for stress.
Yeah.
Ashwagandha too is what we would call, it's a modulator.
Right.
So if you're down, it'll bring you up. If you're you have anxiety,
Yeah.
it's going to bring you down.
Lower it
So
down.
yeah, and very, I would say gentle if you tend towards
Yeah.
anxiety. It's good.
Yeah.
Yeah.
All kinds of choices and,
That's so
and
good.
opportunities, which is why we
Yes.
need Dr.
Yeah,
Jaeggli as our
yes,
expert.
yes,
To,
yes.
how do you pick which one? And right, that's where those consultations with patients and getting really
Yes.
into their specifics
Yeah.
really help.
And that's where
Yeah.
kind of, say if you're seeing a naturopathic doctor,
Yeah.
you know, where you're getting personalized care and you're
Mhm.
getting a lot of time, you
Yes,
know,
yes.
getting a lot of time with us to
Right.
go, what do you need? Like,
Yeah.
what do you need for your body at this time?
Right.
Yeah. It's all
Yeah.
so important.
Yeah.
Yeah.
So let's see. Anything else on perimenopause, or should we start getting a little older and getting
Yeah.
into that menopause here?
Well, I think a lot of the things that we're going to talk about in
Yeah.
menopause,
Mhm.
as far as dialing in the hormone levels, really,
Yeah.
and our choices are also relevant for
Yeah.
perimenopause. So
Right.
perimenopausal women, you can still join us on this journey, right?
Yeah.
Even if you're not quite there yet. Like
Mhm.
when we're starting to use our bioidenticals, you know, and how we start to manage them, relevant still for you.
Yeah, I think so
Mhm.
too. I think one of the bigger questions that I tend to start seeing in that menopausal group is around safety and a little bit of like
yeah.
fear or uncertainty. And I mean, we have cause for why that thought process is in place, but
yeah.
things have shifted, right?
They
You want
have.
to talk a little bit about
Yeah,
some of the
yeah.
shifts? Yeah.
So a lot of the research around safety
Mhm.
originally has been done on the non-bioidentical hormones, right? Or
Right.
synthetics.
Manufactured,
Yes.
pharmaceutically derived, chemical type hormone
Exactly.
structures.
Exactly. So, which people might be familiar with, like Premarin. You don't see it so much
Yeah.
now because we're understanding now that
Right.
it's really hard on women and not necessary, right? I don't care to use it. I'm not saying that there maybe couldn't be a place for it, but I don't know. I'm not convinced.
I'd be hard stretched on that one
me too.
nowadays.
Yeah.
I'm not sure.
I don't think you
Yeah,
need it. I think
don't
we
think so.
need to use the other alternatives,
Right.
the bioidenticals. So,
Yeah.
and I think a lot of standard docs
Yeah.
are moving in that direction too.
Absolutely.
Right, or going,
I agree.
Why am I prescribing this
Yeah.
synthetic when we have this beautiful bioidentical over here?
Right. And I think let's just take a second too, because bioidentical, it's a little bit of a buzzy word, and
Yeah.
that's okay. But
Yeah.
generally, what we mean by that is we're working with hormones that are the same chemical structure of what the female body
Yes.
would normally produce on its own. So that's why some people will say they're like natural hormones or bioidentical, so
Yes.
biologically identical. But what that really means is that those hormones are structurally same as human production, in which it wouldn't necessarily be seen by the human body as like a drug or something foreign that might be reactive or have those lists of side effects that we would commonly see by the chemical manufactured hormones, which are like brand name Premarin or brand name Provera. So totally different. And so just to clarify.
Thank you.
Yeah.
And I was like, okay, coming back to safety.
And
I
then-
was kind of
yeah,
like,
and then
where
we
was
go
I
there.
going with that?
That's okay.
Yeah. No, this is good. So the bioidentical hormone, the research on those, again, they're mimicking your own natural hormones, or they are your own natural hormones.
Right.
Very good safety profiles. And I would say that this also matches what I see in my patients and
Okay.
have seen for the past 20 years.
Yeah.
Now, I always want to say this, and I say
There's
this
always
to
a
every
caveat.
patient. There is always a caveat.
Yeah.
If you personally have breast cancer or hormone-driven cancer,
Right.
you're not doing any estrogens.
Right.
I'm not going to give you estrogen.
Right. Because there are cancers, typically breast cancers, that we know are fed or progressed by the use of hormones, or whether your body's producing that hormone
Right.
or whether you're taking that hormone. And so obviously we don't want to ever encourage a cancer growth in
Right.
somebody who has that specific kind or type of cancer or cancer risk.
Exactly.
Yeah.
Exactly. And I mean, and every doctor is going to give you that
Mhm.
same message.
Absolutely.
Because we really, the paramount thing is your safety, right?
Yeah.
Everything we're doing for you and recommending, we're going to make sure that you're as safe
Yeah.
as possible with the known information that we have, right?
Right.
So,
Right.
so now that said, if there is, say, let's go next level, you
Yeah.
don't have any history, but
Right.
you have a very strong family history.
Right.
Well, you still might be a candidate, but we, again, for you, we need to really deep dive on
Yes.
all the estrogen metabolites that are inflammatory.
Okay.
We maybe are only considering like the weakest
Okay.
estriol,
Right.
you know, the weakest protective.
Right.
Now, and progesterone, which is
Mm-hmm.
very, very protective of all those cells, your breast, ovaries, uterus, maybe, or maybe we're just looking at progesterone, right? Like,
Right.
that is
Right.
possible too. So, but again, if it's like mom, sister, aunt, like everybody, it's like, you've probably, that family history has just
Right.
also probably excluded you, you know, or
Right.
at least being the most safest choice, right?
Especially if we can work to move the needle on how somebody's feeling with all the other caveat of
Yes.
tools that are available, from
Yes.
lifestyle to diet to less risky hormones or herbal opportunities and things like that. Yeah.
Exactly. A lot of herbs that actually will bind naturally those estrogen receptors that are even weaker than our bioidenticals, so can be safer, right?
Yeah.
If that's where we're at. Maybe they're not quite as effective, but certainly if you're having hot flashes, night sweats, things like that, can help. You know, like maca, or I saw a rhubarb extract that was really interesting.
Ooh, cool.
Yeah. Of course, black cohosh is a little more estrogenic.
Yeah.
And then there are some foods like soy, which I don't really recommend soy that much. A lot of people have a food allergy to it. And then also hops, flax, things like that. All of the phytoestrogen foods, right? Yeah.
But the thing that I thought was interesting, so you're right, most of the literature, you know, goes back to the good old WHI trial in like the 90s or so. It was like, oh my gosh, hormones are really bad and increased risk and problem. And we were even saying it back then. If you delved into that literature, it was very much not on the types of hormones we were looking at, but globally became canned into a bottom line message that quote unquote all hormones are bad, so to speak. And so therefore tons of women were just simply stripped off of their hormones at that point. And prescribers in general became really nervous and not willing to prescribe hormones at all. But what's been really great is that there have been studies that come out since then, just in the last year or two, that I love this one in particular. It actually said it was something to the tune of, in actuality, most women would benefit from the opportunity to use hormone replacement for a symptom management perspective, in which we're still at the point where we're like really not using hormones to, you know, treat or prevent heart disease or osteoporosis.
Not quite yet.
Not quite yet.
Yeah.
There's some thoughts on that, and there's some work in other countries, like specifically in Asia, that does a really good job of osteoporosis prevention and treatment. But we're not there yet.
The U.S. is always more conservative.
Absolutely.
Medically conservative.
Absolutely.
Yeah.
I agree.
Which can be great and can be bad on both ends, right?
Are you starting to see a shift in the consumer perspective of hormones? Okay.
Yeah, I would say so. I think at least women now are open to the conversation. You know,
okay. Yeah.
And so, you know, so let's dive into like menopause, right?
Yeah.
We're starting to think about that, right?
Right.
So I think now I still find interesting that a lot of times people's standard docs, usually they're MDs, are often not willing to do bioidenticals, or if they are, it's for a very short period of time.
Right.
Just to maybe get
5-ish year kind of.
Yeah, I even see 2.
Oh, 2. Okay.
Yeah, where they're like, oh, hey, you've been in menopause for 2 years. This is probably enough. You know, we need to take you off.
Right.
And so what I'm finding is that, you know, women come off and then they're like, oh, this is not good. My quality of life just plummeted. You know, it just really, oh my goodness, it just went way down. Like
Right.
now I can't sleep. I'm
Right.
like night sweating all night long.
Yeah.
I'm hot flashing during the day. It's disrupting like my work, my meetings,
Right.
like
Memory, brain
oh
fog,
my gosh, brain
snappiness.
fog. Yes,
Yeah.
yeah. Brain fog is a huge one.
It is a big problem.
Even like a concern of they're like, I think like I'm worried I'm gonna end up, needing care. Like I'm
Yeah.
only 53 and
Mhm.
I can't remember where I put my keys now. And
Right.
it's been like 6 months ago when I was on my hormones, I was just fine.
Yeah.
Now I'm concerned for myself,
Yeah.
and
Wow.
even my
Wow.
husband's concerned. Like, what's wrong with you?
Right.
And yeah, estrogens impact the brain quite a bit,
Yeah.
So then, as you mentioned, like there's
Yeah.
all these underlying benefits that we're not even really aware of.
Right. We don't know yet.
Well, in the research, we do
Yeah.
see that estrogens protect us cardiovascularly.
That's true.
Yeah.
That is true.
and we've known that for many, many years.
Right. But I think there's even more beyond that.
Oh,
that is,
absolutely.
I mean, because
Yeah.
we've already identified, I can't remember the exact number, 300, 500 different mechanisms of hormone activity in the human female body. I mean,
Yeah.
300 to 500
Oh
different
my gosh.
things.
Yeah.
And then it's the what else don't we know yet?
Exactly.
So,
Oh yeah. What
yeah.
else don't we know? And
Yeah.
so we know it impacts bone density. And yes, again, the brain,
Mhm.
your tissue.
Oh, yeah.
So how many women, once you hit menopause, you're like, have I just like gained 50 more wrinkles on my face
Mhm.
because your lack of collagen, your
Right.
collagen levels start, just
Mhm.
take this exponential dive downward.
Very
So
quickly.
very quickly.
Yes.
Yeah, very quickly. And so you're like, no,
Yeah.
thank you.
Yeah.
Like I need to do something
Yeah.
about this. This is not
I
acceptable.
definitely use estrogen face
Oh,
cream every single
do you?
day.
Oh,
Absolutely.
Good job.
I do.
Need, I need
absolutely.
to start.
Yeah.
I've been telling myself, so currently I'm doing my own regimen. I'm
Yeah.
doing testosterone,
Sure,
which has
sure.
been amazing.
Ooh, yeah. We got to talk
and
about
I'm
that.
on, yes, we're
Yeah,
going to talk
okay.
about it. And I'm on progesterone. And
Uh-huh.
I more recently, I'm probably like 10 months
Mm-hmm.
into no period. So
Yeah.
I'm a recent,
Yeah.
menopause. But so I was just going, okay, now it's time for me to start my bioidentical estrogen.
Yeah. Yeah, for sure. I think
Yeah.
definitely a good thought process. And the nice thing with the topical for a face cream is, you really likely could even possibly consider it perimenopause because it's directly tissue treatment versus it's not systemic. It's not
Yeah.
going to change how warm somebody is or how
Yeah.
great their brain is synapting up and everything. But
Yeah.
but what I think about it and how I talk about it is that estrogen, like in tissue, whether it's face or vaginally or et cetera, it's pumping up the balloons. Your cells are balloons, and
It's a
as you
plumper.
and as you start to decline in hormone production and age and stress, all the things play into it, your little cellular balloons start to shrivel.
Yes.
And when they shrivel, we all know what shriveled balloons look like
Yes, we
after
do.
a birthday
Yeah,
party.
it's very sad.
It's very sad. The balloons are not fun
And the
anymore.
face are shriveled
Yeah,
little,
it's
little
just-
face balloons.
Yeah, so it's helping with that collagen production and just helping to plump that back up.
Yeah,
I mean,
I love that.
It's not going to fix everything.
Yeah, no, hey, we take
helps.
anything we can get, like in
Yeah.
that area, as far as like, well,
Yeah.
we all want to feel. I think
Right.
we all want to look how we feel on the inside.
Yeah, absolutely.
And a lot of women are like, I still feel great. Like
Right.
I am, I have great energy. I'm like crushing it,
Yeah.
like at work or like, working out or whatever.
Yeah.
Like, and why I feel like I too many wrinkles, right? And
Yeah.
and I don't think, I don't want to like age shame. And I know
No,
there's
for
some
sure.
women that are
Yeah.
like, I think it's beautiful, and it is beautiful.
Yep. Yeah.
But I think it's also okay to look and feel vital.
Well, and the thing of it is too is it's going to be a progression, which
It is.
we know,
Yeah.
and it's not the wrinkles so much that are concerning. I frankly would be comfortable with that, but it's the fact that we know that skin and tissues are going to continue to thin over time.
That's right.
And it's
Yeah.
trying to give that added protection, that added
Yeah.
armor, so to speak,
Mhm.
for that longevity piece of maintaining where
Yes.
we're at this time. I mean, frankly,
Yes.
if we really wanted to prevent wrinkles, we better start at it when we're like 16,
Oh,
right?
yeah.
With really good
Yeah,
daily
right,
moisturizers
yes.
and sunscreens and
Yeah,
all
stay out
the
of
things.
the sun. That's
But
true.
You know, for me, it was like, oh my God, I turned 20 and oh my gosh, I should have cared. And then it was 30 and then it was 40 and now it's a big 50. So, you know, it's that progression that you want to just sort of learn and maintain and all that. But you said something a moment ago and I want to hear more about it. And I think our audience does too, is that piece of testosterone in women.
Yes. So good, ladies. Okay.
Yeah.
Testosterone in women. So testosterone now, given our levels of testosterone compared to men.
Oh, right.
So small, like unbelievably, like, I don't even
fractionated.
know. Fraction. If we're here, men are here, right? But that's okay. I mean, whereas we are more estrogen dominant in our lives and they have very little.
Right.
It's the same. We have, you know, a little bit of testosterone. They have a lot. And so now that said, women still need and benefit from testosterone therapy. And so I measure testosterone in women.
Okay.
And there is actually a range in the lab that reflects it for women.
Okay.
And so, and what's really fascinating, I mean, I'm telling you, women in their 30s, 40s, 50s, of course, 60s, 70s, 80s, like, I can't tell you how many women are at the bottom of the lab.
Really?
All the time.
We're not maintaining.
Oh, no. And that comes back to stress, right? It's that
Okay.
suppression of those types of hormones. Because most of our testosterone is going to come from estrogen converting and back a little bit back into testosterone or into testosterone. And also DHEA from our adrenal glands are converting some testosterone into some testosterone.
And if our cortisol is freaking out, then our adrenals aren't even making the DHEA that we need.
Exactly.
Okay.
Right. So, so now the range for women is like, it's ridiculous. In some labs, it's 0.1.
Okay.
Now,
that seems awfully dang low to be.
So you can only truly be deficient if you're 0.
Okay,
which I
that
don't
doesn't
believe.
make sense.
No, it doesn't make any sense. So we're like, what? Are you kidding me?
Yeah.
0.1. Right. Oh, you're fine. Look at that. You're there on the range. Up to, depending on the lab, like 7, 7.3, something like that.
For a total?
Or
free?
No, that's a free.
That's a free. Okay, free testosterone. So there's different kinds of labs that can be drawn, and there's a panel essentially.
Yes, exactly. Yeah. So I find even just taking women, like the last time I measured mine before I started testosterone, I was 0.7.
Oh,
0.7.
Yikes.
That was not great.
Yeah.
No, I mean, I feel really blessed to have good energy, and I do a lot. Like, I'm doing a lot of vitamins and supplements, and, you know, because I have access to everything here, which I feel, again, very blessed by, right? So I'm good energy, but knowing the benefits of testosterone, and I lift weights, right?
Ooh,
and I love lifting.
Yes.
And I'm always like, how can I? Because I'm a kind of a tiny person.
Yes.
And I'm petite, and I'm the lightest
gotta
lifter
protect
in the
your
gym.
bones.
And I want to protect my bones, right?
Forever.
Right.
Like, you gotta lift and get that.
Yeah, that's for bone density, right? Yeah. And so I'm always like, ooh, if I can get a little help with my muscle strength. And then also libido is great for ladies to support that too, right? And I do find that to be a big concern for my women.
All the time.
Yeah, and stress crushes that libido. Right. I mean, and, you know.
Who's got time to think about that if you're putting out the 10 fires of the day, you know? So, right, for sure.
And then you know, I always like to joke with, you know, with my ladies that men have that driver of, okay, if they're optimized at 700, 800, 900, and that's a total testosterone for men, but it's such a driver of libido. It really is. And so no wonder they're dying, right? They have the flu and they're like, you know, you could be like, would you like to have sex? And they're like, yes, I would. And I'm like, yes, I'm dying. It doesn't matter. Yes, thank you. I'll take, you know, you're like, what? Are you kidding me? You know, and that's part of it is that testosterone is just
pushing.
It's, you know, yes, they are. That's what, like, if you're going back to just like, thinking about women are here to nurture and have, you know, have the babies. Men are the gatherers, and they're the populators, right? Like, so it kind of comes back to that. So, so for women, if we can just move that testosterone up a little bit, it it can push that desire up a little bit. And I tell my ladies to take some of their testosterone cream and apply it vaginally.
Right.
And that can be very stimulating and nice, right? Like it can feel nice and be like, oh, it's a little tingle.
Right.
Like, oh, okay, maybe it would be okay to think about, having some sex or something like that, right? And for a lot of ladies, because that can be, of course, a point of contention in a relationship sometimes, right? Especially in our longer term relationships, that can be helpful. And then, so I also noticed that doing testosterone, I feel stronger in the gym.
Oh.
I do.
Okay.
Yeah, I noticed a difference.
Okay.
Like bringing it in because testosterone does support muscle growth.
Okay.
And repair, actually. You heal faster when your testosterone levels are better.
Okay.
And that's, of course, all the research is on men and testosterone, but that's what they see in men.
Right.
That it's a big driver of healing in men. Right. And we get that same benefit. So muscles are going to repair faster post-workout. But also, actually, it applies to even your own general healing, like you were sick, right? And then now what they see in men in blind placebo, basically blind studies, that they've had groups of men going, at the hospital. Men that were tested had very high levels of testosterone versus men that were low. No matter why they were in the hospital, it didn't matter. The men with really good testosterone discharged faster, way faster.
Wow.
No, regardless if it was like pneumonia, whatever, injury, it doesn't matter. So women, we do get that little bit of extra healing benefit by doing a little bit of testosterone. Now, I would say there's definitely an optimal range.
Okay,
I mean, if you could get up to the top of the range for women, because again, we are so small, and a lot of women will be concerned. Well, I don't want to grow hair.
Right.
I don't want a beard.
Right.
I don't want acne. I don't want my voice to change. And really, if we're staying, like, even if we're a little bit above the women's natural range, I
hardly ever see it.
Right.
Yeah.
I mean, maybe you're going to get like one extra chin hair, but you're like, I'll just pluck that sucker out.
Yeah.
It doesn't really matter, right?
Yeah, I agree. I think it takes a lot. And I think, you can kind of jokingly tell where you're like, oh, maybe a little too much testosterone, just a little too feisty there.
Yeah, a little too, or irritability.
Irritability.
That's something you have to watch for.
Yeah, you do have to watch for that.
Yes,
we kind of even tell our women when we're counseling them, like, maybe mention to your loved ones if at any point you start getting just a little argumentative or a little edged. That you might want to look at that, because what we also see too, though, is that increase in energy that they've never had or they've been missing for decades.
Yes.
That they're like, I feel amazing.
Yes.
And so sometimes, are a little bit blinded to the, and also.
Yeah, right. And you're like,
but it's not very often. I say for the most part, it's like, it seems to give women, when they come back to pick up their refills, dang, the curtain got opened.
Yeah.
I am now able to do what I used to do after I've, done my job, done my thing. I still want to go to the gym. I still can be that great mom. I still have time to bake those cookies on the weekend and not feel like I just need to crash on the couch.
Right. Yes. Yeah. And I think it's definitely part of that whole picture, right? Of when we're considering, you can do testosterone therapy on its own. You don't have to have estrogen, and you don't have to have progesterone. So this could even be before perimenopause. This could be for my ladies that are still having great normal cycles, but that just want that extra support and drive and energy and So like at any age we can consider this.
Right, and it's something that's really relevant for monitoring and safety and tracking. It's like you can tell how they're doing based on symptoms. You can grab labs that can be correlated to what's really going on. And, metabolic pathways is just not much of a concern in that case. So,
exactly. Because we are keeping it very close to within your normal range. And it really doesn't shift into anything negative, right? Yeah.
That's awesome.
So it's kind of just mostly benefits besides just watching those symptoms of, I've had women where, this was for a lady, she was working with a specialist for, she had pretty severe vaginal pain, vulvodynia.
Oh, yeah.
And testosterone is actually indicated for that vaginally. And so her doc had put her on very high levels. And she was like, first, she was like, my sex drive is out of control. I feel like a teenager boy, or whatever. She was like, I think a teenage boy would feel like. And then she started getting some acne and started getting a little hair growth. And so, but she was way above. Gosh. So, I mean, it really takes a lot of testosterone. And she just dialed it down. And then it was fine. Then it was fine.
Yeah,
and easy to back to normal. Yeah. It was all good.
Guide. Yes. Oh, that's so awesome. Yeah. Well, I know we're getting a little bit low on time, but if there was like one really great tip or pearl that you want to leave the audience with, or something to think about based on this conversation, what would you want to leave them with?
What I would say is that bioidentical hormone replacement and consideration is a very individual decision. So what this means is that you need to come back and look at, what's your quality of life like? So I check in with my ladies every year and I'm like, okay, and that you don't have to have a hard stop on your hormones at a certain age, right? Okay. Yeah, you do not. And I think this is an unfortunate narrative that has been in our standard medicine. Yeah. And I think things are shifting now, but often my ladies will come to me and be like, my doc, I've been on them for 2 years, 5 years, and they said, you're done. Like I'm not prescribing this anymore for you. I don't feel comfortable, safe. And it's because they haven't delved into the research, right? They don't understand the safety around these hormones. So I feel like it is an individual choice and decision, you going, okay, here's how I feel. Here are all the benefits in my memory, my cognitive function, what my bone density is like, my muscle strength, my skin, my heart integrity, my decreased risk of cardiovascular issues, stroke, heart attack, all based on bioidentical hormone therapy. And then, of course, we're dealing with all your hot flashes, night sweats, all of those things. Those are controlled. That, if your quality of life is so much better with your bioidenticals, and we're watching for all these risk factors and you're doing all your standard screenings and all of that, then every year it's okay if you're like, you know what, I'm okay with staying on my hormones for this year again. Right. This should be up to you. Right. Now, if you have some flags come up medically, things change. Of course, things change. Yep. Then we deal with that, right? Then we change the regimen or you stop at that point. But really, I mean, doing bioidentical hormones with people for over 20 years now, so well tolerated. Yes. So well tolerated and actually very low risk overall. Right. Yeah. I think that's wonderful. Yeah. And with that too, audience, it just shows how important it is to have that provider who is an expert in that area that can help you with your health. And it's okay that maybe your primary care doctor might not be their jam. They might not be trained in that. They might not have interest in it. That's totally okay. But there are providers. There's amazing doctors like Dr. Jaeggli who are hormone optimization specialists. And thank you again for being here. Oh my gosh, thank you so much, Donna. Yeah. It's been so good. I'm so glad we had this conversation. Yeah. And I want to make sure our audience knows how to connect with you too. So it's Dr. Angila Jaeggli, naturopathic physician, over 20 years experience at Sage Integrative Medicine here in Edmonds, Washington. The website is sagemedclinic.com. You can also find her on Instagram. She is such a star on social media. Puts out such great content. But at Sage Integrative Med is her Instagram channel. She has a Facebook channel also and a YouTube channel that is Sage Health TV. So lots of great ways to check out more information about you and your clinic and the other providers that are here at your office. Yes. And so with that, thank you so much for coming in. Thank you so much. It's been wonderful. Thank you so much. Thank you to all of your people. Yeah. And if you have questions, you're curious about this, absolutely reach out. We would love to hear from you. So yeah, that is for sure. And that is all for today's episode. Thank you so much for listening. If you enjoyed what you heard, please subscribe to our channel, give it a like, give it a share, spread the information. Stay tuned for more insightful discussions on health and wellness. And until next time,
Take care.
Take care. Bye.